Femtosecond Laser Assisted Cataract surgery, though adding a new dimension, does come with its own learning curve, and certain precautions which have to be taken at each step can help prevent the occurrence of complications. Preoperatively, it is important to ascertain that the patient is awake and alert, and that the patient can lie flat and still, unlike a patient like this. Other important things to be ensured are that the palpebral apertures are reasonably sized. Pupil dilatation should be more than 6 mm, and preoperatively, non-steroidal anti-inflammatory drugs can be advised to the patient. When docking, it is important to ensure that the eye is flat to the plane of the patient interface and to ensure adequate centration of the dock. The opening of the incisions is done with a spatula that is specially designed for it, and it is important to ensure that the entry is made in the correct plane where the femtosecond laser has created the incisions. While removing the anterior capsular opening that is created by the femtosecond laser, it is important to ensure that it is removed like a manual capsulorhexis. This helps prevent extension in case of an incomplete capsulotomy. When performing hydrodissection, it is important to perform a gentle rock and roll maneuver. This helps release any air bubbles that might be trapped posteriorly. Following this, a gentle hydrodissection should be done. Complete nuclear rotation should be ensured before moving on to phacoemulsification. Nuclear fragmentation is usually easier with the femtosecond laser surgery, but it is important to ensure that manipulation is gentle and complete cracks should be performed. Cortex aspiration, though usually uneventful, may also occasionally be challenging, as a circular disc of cortex is also cut out by the femtosecond laser. After understanding these principles, femtosecond laser can prove to be advantageous in the most challenging cases. In a patient with a subluxated cataract, FLACS provides the advantage of capsulotomy being centered onto the capsular bag. After removing the anterior capsular opening, like a manual capsulorhexis, a gentle hydrodissection was performed. The subluxation is grossly visible now in this case, and a capsular tension ring had to be placed early on. After stabilization of the bag with the capsular tension ring, the phacoemulsification was a lot easier because of the nuclear fragments already being separated. An anterior vitrectomy had to be performed, but the IOL was well centered to a great extent because of the capsulotomy being centered on the capsular bag. When performing femtosecond laser assisted cataract surgery in a white mature cataract, the posterior capsule might have to be delineated manually, as the anterior segment OCT often does not pick it up. The surgery, however, provides the advantage of the capsulotomy being performed in a closed chamber. Staining of the anterior capsule is a must. In this case, an area of incomplete capsulotomy was noticed, but the capsule was removed safely. In this case, femtosecond laser assisted surgery is being performed in a patient post-radial keratotomy. The flat cornea can be appreciated on anterior segment OCT. The procedure was uneventful, but there was an opening of one of the radial keratotomy incisions which had to be sutured at the end of the surgery. Femtosecond laser assisted surgery also has advantages in a hard brown cataract. Along with separation of the nucleus into multiple segments, it can also be softened. The anterior capsule can be removed quite easily using the forceps, and the separation of nuclear fragments is a lot easier due to the softening and segmentation that has been performed by the femtosecond laser. And once the separation is achieved, removal of the fragments is routine. To summarize, femtosecond laser assisted cataract surgery can be a great tool to the cataract surgeon, but requires a thorough understanding of the machine and the surgical technique. The surgeon should also be aware of and be ready to face the learning curve that comes with the procedure.